Hello, I hope everyone's day is going well. So today I want to talk to you about a topic related to males, specifically what's called male menopause or low libido and testosterone replacement. So, in males, your body produces the hormone testosterone. I think that's pretty much common knowledge. With this hormone's made in the testes, and it really serves a variety of functions, including fueling your sex drive, stimulating changes during puberty, supporting your mental and physical energy levels, helps maintain your muscle mass, helps regulate your fight or flight response. And just like women go through menopause, men also experience a decline in the hormone levels as we grow older. And this is kind of referred to as male menopause. So when a man hits male menopause, testosterone level really starts to decline. And it really starts around the age of 50, and then continues from thereafter. So often people, when they enter this phase in life, will have a variety of symptoms, and so it can be somewhat similar to female menopause, but there also is many differences too. So one example is not all men will experience it to start with, and it doesn't really cause your reproductive organs to shut down. It really just lowers your testosterone level, which can result in some sexual dysfunction. But really, the important thing to understand is what is testosterone? Well, it's the male hormone that's going to stimulate the changes you notice around puberty, such as, increased muscle mass, body hair growth, change or lowering and deepening your voice, change in your sexual functioning. And typically before puberty, males have a low testosterone level, and then this level will gradually increase as you kind of mature until you hit puberty. The important thing is to understand that as you kind of cross that middle age and get older, your testosterone levels will typically start to reduce at that point. So, in fact, there's some research that shows that men's testosterone levels tend to decrease by about 1% every year after they turn 30. So you can have some health issues related to low testosterone levels earlier than 50, and it's really individualized. So that's kind of one of the things I want to talk about today is what should you look out for, what can you do, things like that. So what are some of the symptoms of male menopause? Well, first of all, there's a wide range of symptoms, from sexual, physical issues to psychological ones. These symptoms usually will get worse as you get older and experience more testosterone reduction. Some of these symptoms include erectile dysfunction or low libido, infertility, depression or low mood, low energy levels, insomnia, low self-confidence, high body fat and less muscle mass, breast development, decreased bone density. You may also experience like hot flashes, body hair loss, reducing your testicular size, swollen and tender breasts. So these symptoms aren't necessarily common, but they can be typically found in men around the same age as women that go through menopause. So when we talk about low libido, this really refers to kind of the reduced interest in sex, or simply put, libido is your sex drive, and it's not abnormal to periodically lose interest in sex. This is very common. Your libido levels will vary throughout life, and another interesting thing is that it's also normal for your sex interest not to match your partners all the time. So some fluctuations in your sex drive or libido is normal, but it's also important to understand that a low libido or low sex drive for a long time, this may actually be cause for concern because it may indicate that there's some underlying health issues that needs to be addressed. So when we talk about low libido, one of the things that causes that is low testosterone. So again, testosterone plays a vital role in your overall well-being as a man. It helps build bones and muscles. It impacts your sperm production and your sex drive. Now, the normal testosterone levels can vary from men to men, but so it's a pretty wide range of what the normal is. The important thing is to understand that as your testosterone levels, how it affects your sex drive. When your testosterone levels drop, so does your desire for sex. So what may be a normal testosterone level in some may be low normal for you, and as that drops further, you're going to have again a reduction in kind of your sex drive as it will follow the drop in testosterone. So how does aging affect this? Well, aging, your testosterone levels are linked to your libido, as I already said, and your highest levels are in your late teens. But as you grow older, your testosterone levels are going to decrease, and this is going to maybe result in erectile problems, delayed orgasm, things like that. So as we get older, like I said, typically that 1% a year, a drop in testosterone levels is going to affect your libido or your sex drive too. Now, there are some medications that can help this. Before we go into that, I want to talk about some other causes of things that can affect your testosterone level on the negative side. And that's certain medications. So there's certain medications that will reduce your testosterone level, and ultimately this will cause a low libido. So some like blood pressure drugs like ACE inhibitors or beta blockers, they can have an impact on your libido. Other medications that can lower your testosterone level, like corticosteroids, certain hormones that are used to treat prostate cancer, chemotherapy and radiation. There's certain antidepressants that can affect this. Ketoconazole, which is antifungal, can lower your testosterone levels. Opiates, so these are the narcotics, pain medicines, can lower your testosterone level. Cimetidine, which is a medicine used for urine or gastric reflux disease, it can lower your testosterone level. So the important thing to understand is that, there's a variety of medications that you may be taking that's having a negative impact on your testosterone level, which then is having a negative impact on your libido. So it's important if you're having problems like this, that you need to talk to your physician to really make sure, is there something that you can substitute with that doesn't have the impact it does, or is there a different way to manage it? Now, your self-esteem plays a really important aspect of your libido too. So really, when I say self-esteem, it's really how you perceive yourself. And so if you feel unattractive or undesirable, this is really going to have a negative impact on any sexual encounters. So this is real important, is how you look at yourself, because low self-esteem can result in sexual performance anxiety, erectile dysfunction, low libido, and really long-term self-esteem issues can really cause more significant mental health issues like anxiety, depression, and even drug abuse. And again, all these things are also associated with a low libido. So if you're suffering from a low self-esteem, you may want to seek some counseling or some help for that, because it can have a real negative impact in a variety of aspects of your life. Another thing that can affect your libido, specifically through your testosterone, is alcohol intake. So excessive alcohol intake, it's been linked to reduction in your testosterone production. So it's important to understand that excessive amounts of alcohol really can reduce your libido. In fact, the Center for Disease and Prevention, they state that an adult male really shouldn't have more than 2 alcoholic beverages daily. Higher amounts can result in really a variety of health issues, but including low sex drive. Drug use, recreational drug use, such as marijuana, tobacco, and opiates, they've all been linked to reduction in testosterone production. So this is going to really reduce your sexual drive. So it's important to understand, these things, the impact they have. And in addition to this, just smoking in general has been found to be negatively affect your sperm production and sperm motility. So, really pay attention to this and decide if these are things you should be doing or what's the negative aspect of it. Stress is another big problem we need to learn to address and deal with. You'll never avoid it. So it's how do we address it and manage it? So pressure and distractions are going to reduce your sexual desire, because that stress really messes with your hormone levels. Your arteries may also become narrowed when you're stressed, and this narrowing hinders blood flow and can potentially cause erectile dysfunction. So how you manage your stress is really important for a multitude of reasons, but also when it comes to libido and sex. it can really have a negative impact. So there's other, chronic health issues that can have an impact on your libido. Certain cancers reduce sperm production. Chronic illnesses can reduce your libido, including diabetes, high blood pressure, depression, heart failure, and so on. And some of the medications used to manage these illnesses may even cause a reduction in your libido. So, for example, certain antihypertensives, like I said, an ACE inhibitor or antidepressants may actually be having a negative impact on your libido. So the chronic illness itself can have an impact, but then the medication we're using to treat that may also have an impact. Another important thing related to this is stress, or related to libido and testosterone, is sleep issues. It's really important that we get adequate sleep, and that's 7 to 8 hours of sleep at night, and then good quality sleep. There's a study that found that non-obese men with obstructive sleep apnea, they have a lower level of testosterone. This in turn is going to lead to reduced sexual desire and activity. Another study found that testosterone levels in healthy men was reduced by 10 to 15% after just a week of sleep restriction to 5 hours per night. So a pretty significant decrease in testosterone production with some sleep deprivation. So again, sleep, we're learning more and more how important it is in a variety of things in our life. So that's all the bad news. So what's the good news? Well, the good news is there's things we can do to manage this, and to kind of want to go through that. So really, how your symptoms are managed depends on your overall health status and really how significant your symptoms are in disrupting your daily life. So if your symptoms are not that severe, or you're young or younger, you may only need some modifications in lifestyle. However, if your symptoms are significant and disrupting your life, you may need to talk to a physician to talk about some other treatment options. So let's start with the things you can do 100% yourself. And so, lifestyle modifications is real important. This is really the most common way of treating low libido and male menopause symptoms. So some helpful lifestyle modifications you can include, like eating healthy, obviously, reducing stress, we've already talked about that, exercising regularly, that's going to help in a variety of ways. It will help with stress reduction, but also has a significant cardiovascular positive impact. Getting adequate sleep, I can't emphasize that enough, that we as a society do not get enough sleep, and the impact of that is tremendous. So I encourage you to really get into a good sleep practice. And then stress management is extremely important. And like I said, you're not going to avoid stress, but you can learn different ways to manage it, and so that it's having less of an impact on your life. So that's some lifestyle changes. Now, let's talk a little bit about medications. So first is the medicines that you may already be taking that have a negative impact on testosterone. You want to talk to your provider that's prescribing these medications about the pros and cons, and is there a different medication that you can be placed on to not have that side effect. And then the final thing is really just testosterone replacement. Now that's when a physician will prescribe testosterone or synthetic testosterone to kind of help basically increase your testosterone levels so that it can address all these negative things that we've talked about. But this can be somewhat controversial because this isn't for everyone, because the testosterone can be harmful. And so it's something that you need to really be educated on and informed on. So for example, if you have prostate cancer, you wouldn't want to be on testosterone because it could actually cause your cancer cells to grow more. And there's a lot of other kind of what I'd say contraindications to testosterone therapy, but there are people that do well and are appropriate for it. They can really to manage a lot of these symptoms and help them. So really the key takeaway here is, as you get older, your testosterone levels are going to go down, and you'll most likely have some type of symptoms related to this. And usually these symptoms can be managed with your lifestyle changes that we talked about, such as a healthy diet, exercise, stress reduction, stress management. But the reality is, if the symptoms are affecting your daily lives more than that, and your lifestyle changes aren't helping, then you really should talk to your doctor about what other options or what other ways to manage this are. So, treating low libido is also dependent on the underlying health issues. So, you need to address any underlying causes with chronic illness and medications you're currently on. So, as we get older, it's a fact of life. Our testosterone levels are going to decrease, which is going to make us prone to some kind of chronic problems. But it doesn't have to be completely hopeless. There's things you can do to manage this and improve and really continue on this journey of your health and wellness. So I hope this is helpful today. Just remember, it's your wellness, and so you've got it. Thank you.